Hi, my name is Tommy. I'm going to be your nurse today. Could you please tell me your name and date of birth? Verify it on the patient's wristband. I'm just going to wash my hands, pull the curtains, close the door. I'm going to be doing a neuro assessment exam on you today. Do you have any concerns with your safety? Patient denies. Moving on to the next part of the exam. Could you tell me your name, where you are, date and time? Client able to identify all 4 alert and oriented times 4 responses are appropriate for the situation. Cranial nerve 1, we're going to test first for smell. Close your eyes. Could you tell me the object I'm holding up to you? An alcohol pad. Patient able. Next. Cranial nerve 2, we'll be using a Snellen chart. Could you stand 20 feet away? Cover one eye. Read the smallest line on both right and left sides. Patient able. 20/20. Cranial nerves 3, 6, and 11. Test for the 6 signs of cardinal gaze. Just follow my pen. Patient able. Cranial nerve 5, test for facial sensation. I'd hold a cotton ball lightly on each side of the cheeks, forehead, and chin. Patient can feel in all 5 areas. Cranial nerve 7, test for facial movement. I would ask the client to smile. I would assess for both sides being symmetrical, no drooping present. Patient is able to move the face. Cranial nerve 9, test for swallow. Ask the client to look up a little and just take a swallow. You can see the esophagus rise with the swallow and fall. Patient is able with no limitations. Cranial nerve 10, test for the uvula. We can do 10 and 12 together. Ask the tongue to stick out. Uvula rises, tongue to the midline for 12. Cranial nerve 11, shoulder shrug, and then turn against resistance. Client able, 5 out of 5 muscle strengths. Reflexes, first we would do the tricep reflex. We would assist the client with relaxing the arm, striking with the hammer, and looking for a response. Bicep, same thing, just on this side of the arm by the bicep. You would strike where it's almost connected to the bone. You can feel the tendon, looking for the reflex. Brachioradialis reflex, strike with the hammer, look for that reflex. Able and passing. Patellar reflex, right under the patella, the kneecap. You can feel the tendon there. You strike with the hammer. We would instruct the client to sit on the edge of the exam table or their bed, just dangling and relaxing the leg, striking it with the hammer. Same with the plantar reflex. While the client is laying down, we can strike up. We would want the curls to the toes to curl in. If they curl outwards, that's a sign of a Babinski reflex. And we would notify the provider. Coordination, finger to nose test. I would instruct the client to touch my finger, touch their nose, touch their finger. Client is able. Heel to shin test is used for patients that are bedbound. We would have them lift their heel and bend their knee and touch their shin to test for that motor coordination. Since they are unable to stand, the Romberg test, we would instruct this, if they're able, instruct the client to hold their hands like this, stand up for 20 seconds. If the client sways and moves without knowing, that's a positive Romberg sign. We would notify the provider. Normally, clients can hold their hands like this for 20 seconds and not move. Perfect. Motor strength, I would ask the client on each arm to grip my 2 fingers and squeeze, 5 out of 5 muscle strength, both right and left sides. Sensory testing, I would put a sharp and dull sensation. Sharp, client able to feel sharp, dull side of the pen. Client able on the left side, sharp, dull. They can distinguish between both with the eyes closed. Then we can do the position sense of each finger. So I would ask the client to close their eyes. I'm going to move your finger up and down. Tell me when I'm doing up. Tell me when I'm doing down. Up, up, down, up, down. Do the left side. Up, up, down, down, up. Client able on both right and left sides to distinguish sense of position while eyes closed. Alrighty, I'm done with your neuro assessment today. I'm just going to wash my hands again. Your call light is there on your lap. Your personal items, glasses, and phone are on the table. There's water on your table. Is there anything that I can do for you before I leave? Alrighty, again, call us if you need us, okay?